Um, been quite a whirlwind of a day to begin the week. I guess kind of an overview for people missing out on what's actually been happening. Um, we got the press release. The state has its first confirmed measles case. It's here in the Panhandle. That's a big pill to digest, but I mean, I guess what's the big overview that the public should be aware of?
Well, we want people to know that this was a child that had no recent travel out of state. So that could indicate potential spread within the community. That's why it's so important that they are up to date on their measles, mumps, and rubella or MMR vaccination so that they're aware, they're ready. We've been watching the cases nationally, and as they've come closer to our border states, and now that we have the close confirmation of a case here in Sheridan County. We want to make sure that people are just doing the best that they can to make sure their family and their children are safe. And remember that the health of each of us depends on the health of all of us. And we vaccinate for all the reasons for ourselves, but we also vaccinate for people that are too young to be vaccinated and people that have medical reasons that they cannot be vaccinated. And so we want to make sure that people are just making the safest decisions that they can. If they have concerns that they were at any of the locations that were identified in the news releases, so there's 3 locations on dates and specific times, that if they become symptomatic, that they stay home, they call their healthcare provider before going, and then they can get tested.
And then quite a fluid situation this Tuesday. We added the third site from this morning's media release. I guess as the Panhandle Public Health District, are you gathering more information throughout the day and really getting a more fine-tuned scope, or is it still kind of a larger scope situation that you feel you are tackling?
We actually began our response yesterday, and so the additional location was identified today, which was why we updated the public as soon as we could. And so we feel confident that we have the majority of the information now. Close contacts have all been communicated with very directly. They have the process for the surveying and monitoring, and then we, put out the public information so people can be aware, and make the safest decisions for themselves and their families and know what they need to do for next steps.
Now, and in the Tuesday afternoon release, there was a mention of, if you are possibly exhibiting symptoms of measles, don't go straight to the hospital. Is that the correct advice for
That,
people at this moment?
yep, that's exactly what we want. We want them to, if they are experiencing fever along with a runny nose, cough, red and watery eyes, and a rash, we do not want them to go to their healthcare, uh, to the hospital, to the clinic, anywhere. We want them to call ahead, and then they will determine testing from there so that we can make sure that there's not additional exposure if it were to be, a confirmed case. We want to make sure everybody ahead has they've got their procedures that they're working on as well. And so that they're ready and they can adequately do the testing and we can continue to keep everybody as safe as possible.
And then what's the step going forward? I think when the first cases were reported in the southern part, like a couple states south of us, Texas, and I'm not sure on the other, it was kind of a red flag, scary, but I never really followed up on what happened next. So I guess once we get this controlled to whether it's be the one case, possibly three, five, what happens after that once we figure out who is contracted the measles or rubella or anything like that, and then proceeding afterwards? What's the game plan as PPHD?
So from our standpoint, we're just continuing to monitor any risks that are possible in the community and throughout. The whole idea with identifying close contacts is because they have to, if they have not completed vaccination, and there are some other stipulations that go along with that, but they have to then quarantine for at least 21 days from the date of when they had their last exposure to the potential case. And so, as we continue to monitor, as people come in with symptoms, then we will follow up for on those cases. If there are additional positives, again, we go through this process, identify close contacts, and the whole goal is to slow the spread. We want to keep our residents as safe as they can so that they can continue to enjoy enjoy the summer, enjoy all the wonderful things that summer brings to us. And so we want people to just be making as safe decisions as they can. We can slow the spread and we can effectively contain this disease as much as possible, especially because it is so highly contagious. And we want to make sure that we're keeping our most vulnerable populations in mind, people that could have higher level responses that could be very detrimental to their health.
And this seems like a flashback to half a decade ago in the midst of the pandemic. And it took me aback with it being the one identified this week was fully vaccinated and everything, but still contracted it. Is that an anomaly for you guys of like how could someone fully vaccinated for the for measles get
And
it?
I want to say that they were age appropriately vaccinated child. So fully vaccinated is 2 doses for the appropriate age. So they were age appropriately vaccinated. And what was the second part of your question? Okay. So it's 93% effective with the first dose. It's 97% effective with the second dose. So yes, there's always potential for that, but as we saw with this case, it also symptoms remain mild, child is recovering. So that's the goal really with a vaccine as well, is that it keeps symptoms mild and it really prevents, I think about it just like a seatbelt. It's not going to prevent that you're in a crash, it's going to prevent your ride down and your safety in that crash. That's very similar to a vaccination. And so what we saw with this child is symptoms continue to stay mild, and that's the goal with vaccinations as well.
And I guess just wrapping it all up, what's your biggest plea? I would reckon probably for the next 48 to 72 hours for the public.
Our plea for the public is to know your vaccination status, know your children's vaccination status, and that we have put out all the information for where you can find that information. We have our phone number. We can walk you through where to identify that as well. If you were at any of the known locations to monitor for symptoms, if you're at known locations and you have not been vaccinated, we want you to fill out the survey that you can access on our website. We can also go through that with you if you don't have the internet access or you need help completing it. They can call our office at 308-633-2866. We can go through that survey with them. And so that sets up monitoring for them if they were identified at one of those locations. If they are experiencing symptoms, please stay home. Please call before you go to the hospital, to your healthcare provider. They can get adequately set up for the testing. And then always the goal is just to make sure that we're making the safest decisions for ourselves, our families, and our communities. I think everybody in the Panhandle always wants to do, the best thing for their neighbors and for their friends. And let's continue to keep that spirit so that we can enjoy a really wonderful summer.